This session, they have given the global movement on healthcare reform. And as you know, the healthcare system, a global movement on healthcare system. As you know, the healthcare system is very broad term and covering vast area. Therefore, we will focus our presentation mainly on those initiatives aiming toward delivering safer and quality health care. And since you know, the WHO is directing and coordinating authorities on international health within the United Nations system, is very concerned about delivering safe and quality health care. A lot of initiative has been undertaken to promote quality health care. And sorry that we don't have the slide, because we have showed you that our Director General, Dr. Margaret Chan, has put in the World Health Report of 2012. She has clearly stated that one of the greatest challenges today is about delivering safer and quality care in complex, pressurized, and fast-moving environment. In such environments, things can often go wrong. She also expressed that what good does it do to have a high proportion of babies delivered in health facilities if the quality of care is substandard or even dangerous? This is just reflect that we really need to ensure the quality of care, not only advocating for people coming forward to the health facilities. And probably you already know about the, you know, the burden of unsafe and poor quality of care, because evidence has revealed that 1 in 10 hospital admissions are associated with adverse events. For at least 50% are preventable, and 15.5 in 100 patients in developing countries are associated with endemic healthcare associated infections. And moreover, at least 43 million injuries each year occur due to poor quality and unsafe medical care. This evidence already show that service that unsafe and of low quality lead to diminished health outcome and harm. The WHO has organized an expert group meeting in 2016 to determine global priority for future actions for patient safety by the WHO and countries. And these include counterfeit and substandard drugs, problem with communication and coordination, latent organizational failures, inadequate competence, training and skill of healthcare provider, poor safety and quality culture, lack of human factors and design, misdiagnosis, maternal and newborn health care, unsafe injection and blood practice. And in dealing with unsafe care issues, we need to consider system approach rather than blaming an individual. We need to focus on the health system improvement as adverse events, because the problem of patient safety are primarily due to system failure rather than individual. Although human error does have a role, but it's only part of the problem of lapse of patient safety. Moreover, we need to learn from the problem to prevent its occurrence in the future. We need to learn from the mistake so that we can minimize the risk in the future. And I'm still thinking that I'm the visual staff, even though I have been retired for quite some time. Sorry for that. Even though now I'm serving as the visual consultant, still working for Myanmar. The visual has put safety and quality of healthcare on the global agenda since 2002. The World Health Assembly adopted the resolutions on quality of care, patient safety, urging member states to pay the closest possible attention to the problem of patient safety, and requesting the WHO to support the efforts of member states to promote the culture of safety and quality within the healthcare organization. Since then, various initiatives have been taken at regional as well as country level to promote patient safety and quality of healthcare, including the establishment of Global Patient Safety Initiative, and you probably will hear from Daniel about it, and including adoption of several World Health Assembly resolutions, as well as several of regional committee resolutions to promote patient safety and quality of healthcare. Closer to home, I think that probably I just would like to show you, this is a recent initiative has been taken by Thailand as a follow-up to a resolution that has been adopted in 2015 by the WHO Regional Committee on the patient safety, contributing to sustainable universal health coverage. HAI has been entrusted with the responsibility to be a focal point to carry out a country self-assessment on patient safety situation in Thailand, to identify priority area that requiring attention. Although we are doing quite well in several areas, but there's still some area requiring special attention. And this self-assessment has been carried out during June to September last year, 2016, with involvement of various experts, with the Ministry of Public Health, the professional councils, and the health. I think that I have to say the name in English. The National Health Security Office, National Health Commission, yeah, with all those involvement, and we have critically review this outcome together, and afterward on September, I think 16th September last year, His Excellency Clinical Professor Emeritus Dr. Priyasakul Satayathorn, the Minister of Public Health, has officially declared a national policy on personnel and patient safety to P safety, to give a clear direction to move forward patient and personal safety in this direction. And I'm pleased to know that Thailand probably is the only country that has really looking at both personnel as well as patient safety. And we have a commitment from 15 organizations to sign a MOU to join hands and decided to move toward to translate this policy, national 2P policy, into action. And now there's some effort to formulate a national strategy plan national strategy to translate this policy into action. So this is a recent development in Thailand. And Dr. Daniel, I feel that Thailand will benefit from other countries' experience. So we would like to hear more about the global and regional initiative, what other countries has been doing in trying to strengthen the health system, or that the response in order to promote the quality and safety of the health care. So maybe you can shed some light to us so that we can learn from what has been doing and something that we can bring take home and learn from them and move forward with our agenda. So you have the floor, please.